Good evening, I'm Hunter Kelly. This is Up to Date. The coronavirus continues to plague the country this week. The total cases in the U.S. rising to over 675,000, with 34,000 deaths as of Thursday night. But areas in the U.S. are starting to see progressions, as health officials are saying they are starting to see a flattening in the curve. This is encouraging, but as state governors have said of their states and all others, this optimism cannot become complacency. Instead, the country should use this as encouragement to keep doing what we're doing. We're beginning to see slight signs that staying home is working to plateau the curve, but we must be cautious to rush into opening the country, which is why governors on the East and West Coast are coming together to create a collective action plan to slowly reopen their states when the time is right. The president has incorrectly said several days in a row that he thinks he has the ultimate control over when and how states open. Trump then on Thursday did a complete 180, saying the governors will be in charge of opening the states. We have a lot to get to tonight. Let's get after it. On Thursday, the White House released their plan to reopen the country and its economy in 3 phases. The phases are based on testing, new case growth, and hospital capacity that must be met in a 14-day period. The first phase aims to get businesses moving again, opening up non-essential businesses as long as they adhere to strict social distancing guidelines. Gyms are able to open at this point, along with restaurants and other large venue areas, as long as they keep strict sanitizing and social distancing guidelines. Bars are to remain closed during this time. In phase 2, these businesses will begin to reduce the strictness of their social distancing and sanitizing guidelines, but warns people to still be very cautious. This phase will also allow non-essential travel for people and employees to resume. Bars can begin allowing limited people in. In phase 3, which is where many people will want to see our country again, drops most limitations and brings almost normal life back into the equation by dropping social distancing guidelines and returning to standard sanitizing guidelines. The president said he believes states who meet the gating criteria now could go to phase 1 today. On Monday, the White House held their daily coronavirus task force briefing after a weekend off.
Fire Fauci. Why did you
fire Fauci?
I retweeted somebody. I don't know. They said fire. Doesn't matter.
Did you notice that when you retweeted it?
Yeah, I noticed everything.
The president on Monday night gave his daily White House coronavirus task force briefing, in part to combat a retweet he made Sunday evening that included remarks against Dr. Anthony Fauci, including the hashtag #FireFauci. Dr. Fauci gave this statement to CNN's Jake Tapper on Sunday night about earlier virus mitigation strategies.
But what goes into those kinds of decisions is complicated. Obviously, if we had, right from the very beginning, shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
Dr. Fauci then said on Monday that his words were taken in the wrong way.
If you initiated it later, you probably would have lost more lives. You initiated at a certain time. That was taken as a way that maybe somehow something was at fault here.
During the briefing, Mr. Trump also used a video to highlight his personal accomplishments throughout the pandemic in a campaign-style fashion. However, the video bypassed a whole month, involving no mention of what Trump did in February to mitigate spread of the virus. When asked about it, Trump retaliated.
A lot. And in fact, we'll give you a list. What we did, in fact, part of it was up there. We did a lot. Look. You know you're a fake. You know that. Your whole network, the way you cover it, is fake.
In fact, at his rallies in the month of February after his travel ban to China, the president made these statements downplaying the virus.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat.
Now the Democrats are politicizing the coronavirus. And this is their new hoax.
After facing days of criticism about his ability to open the country's economy amidst a pandemic, Mr. Trump made a startling statement saying his authority as president is total.
When somebody's the president of the United States, the authority is total. And that's the way it's got to be.
Total. Your authority is total.
It's total.
Neither in the Constitution nor in the Federalist Papers is it said that the president has total authority, even in time of a national emergency. Last Friday, Pennsylvania Governor Tom Wolf and his health secretary, Dr. Rachel Levine, estimated the peak of the virus in PA would occur this week. The state has seen record numbers of deaths and new cases of the coronavirus this week, reaching over 27,000 new cases and over 700 deaths. Dr. Levine says she believes there will be several different peaks, different areas of the state reaching different peaks at different times. For now, numbers in the state continue to rise, but data compiled by the PA Health Department shows that 41% of hospital beds, 39% of ICU beds, and 70% of ventilators across the state are still available, putting PA's healthcare system at a lower risk of being overrun. A drive-through testing site in Miami, Florida reached capacity on Monday, this coming after a delayed response to the COVID-19 pandemic in Florida, where as late as March 20th, beaches were still packed with people, as seen in this picture. Florida Governor Ron DeSantis said he believed people at that time needed to, quote, get out and clear their heads to take the edge off. Now, 4 weeks later, the state has over 22,000 cases of the virus and testing sites are at capacity. Governor DeSantis became one of the last few governors to mandate a stay-at-home order on April 1st. On Monday, Vermont Senator Bernie Sanders, who suspended his presidential campaign last week, officially endorsed former Vice President Joe Biden for the Democratic presidential nomination. Sanders and Biden were the last two left in the field after Biden took an almost insurmountable lead over Sanders after the Florida, Arizona, and Illinois primaries on March 17th. Since then, almost all primaries were put to a halt due to the coronavirus pandemic, with the exception of Wisconsin and Alaska, both of which still held their primaries in the last week. And on Tuesday, former President Barack Obama endorsed his former vice president through an online video. The Democratic National Convention is scheduled to take place in August in Milwaukee, Wisconsin. The president on Tuesday announced he was halting funding for the World Health Organization over their handling of China's outbreak of the virus. Take a listen.
The WHO failed to investigate credible reports from sources in Wuhan that conflicted directly with the Chinese government's official accounts.
Just a reminder, the president himself said on multiple occasions to the press and even wrote tweets like this one suggesting he believed China was being completely transparent, praising the work they were doing to handle the virus. Now, a few months later, Trump flips the script, as he tends to do, and instead of taking responsibility for rapid spread due to a lack of preparedness in the country, he blames the WHO for sharing misinformation about the virus the same way he did.
Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat.
Because of all we've done, the risk to the American people remains very low. People die from the flu.
The problem is the WHO does a lot of good for developing countries that don't have the same equipment the U.S. has, giving them test kits and developing vaccines. And halting funds to them in the middle of a pandemic puts those countries at high risk for rampant spread. High spread of a virus in one country can easily transfer it back to another country. This brings us back to the U.S. Halting funds to the WHO doesn't help anyone in the face of a pandemic, and helping is what we should be focused on. We'll be right back.
As the nation's doctor, I often get asked, what should I do if I think I might have coronavirus?
People who are sick should stay home. You don't go to an emergency room, you don't go to a clinic. You get on the phone and you ask for advice and instructions from your physician.
We don't want you to go into the ER or the doctor's office without talking to them first, because you might spread coronavirus to someone else. Please visit coronavirus.gov for more information.
This year, you can complete the census by calling or going online.
Or return your form by mail.
Make your family count!
It only takes 10 minutes to fill out the 2020 census online, over the phone, or by mail.
A French study found hydroxychloroquine, the drug Trump has been touting as the possible cure to the coronavirus, is actually not effective in treating coronavirus. In fact, it's been found to even cause heart complications. In the study, doctors looked back at medical records for 181 patients with COVID-19 who had pneumonia and required supplemental oxygen. About half had taken the drug within 48 hours of being admitted to the hospital. The other half didn't. Doctors followed the patients and found there was no statistically significant difference in the death rates of the two groups. There also was no significant difference in their chances of being admitted to the ICU. 8 patients who took hydroxychloroquine even developed abnormal heart rhythms and had to stop taking it. On March 13th, the president declared a national emergency. He promised increased drive-through coronavirus testing sites done by private companies such as CVS, Walmart, Walgreens, and Target, and even had those companies in the Rose Garden on that day. Trump also touted a website made by Google that would help identify a person's symptoms and tell them what drive-through testing site to go to. 1 month later, NPR's reporting found that none of these really came to fruition. Walmart, CVS, and Walgreens opened a total of 8 testing sites across the country, and Target says they have not struck a partnership with the federal government, so Target has not opened any. The website promised actually was not even led by Google, and when it launched, it was not nationwide as was promised. It was only available in certain counties in California. These are just some of the promises made in the Rose Garden in March regarding the national emergency that over a month later still are not happening. This goes with the massive lack of testing we're seeing in the U.S. Still, people who are sick and showing signs of COVID-19 are being told they can't get tests. The U.S. should not be rationing tests. Healthcare workers all around the world are facing extreme challenges and pressures caring for coronavirus patients every day. It's easy to look at the numbers of people affected and see it as a small percentage of the population, but we all know those numbers are still people. And healthcare workers everywhere have the responsibility for caring for these people. Here's what a New York City COVID-19 nurse said on her Facebook about what she calls her hardest day yet.
Yeah, today was a really rough day. It was a really rough day. It's a really rough shift. I don't know, I just feel like there's only so much anyone can take. I'm tired of walking into rooms and hear patients dead. You just walk into a room and there's a dead body there. I'm tired of calling families and telling them that news.
It's horrible. We all have to try to remember that these healthcare workers' lives are flipped upside down, living in hotels, away from their families, facing the pressures of being the difference between life and death. For many people, they have my respect, and if they have yours too, keep staying at home. That way you can do your part in making their lives a little bit easier. We feel for them, and they're in our thoughts every day. We'll be right back.
New York is the canary in the coal mine. What happens to New York is going to wind up happening in your city and in your community. We are going to fight every way we can to save every life that we can. We are all first responders. Your actions can either save or endanger a life. Job one has to be save lives. That has to be the priority.
The U.S. Postal Service has warned Congress it could become insolvent amid the coronavirus pandemic. The USPS said it will, quote, run out of cash by the end of September if Congress does not help with financial assistance. CNN's Jessica Dean reports.
The U.S. Postal Service is sounding the alarm. Without financial assistance from the government, it will be out of cash by the end of September as the COVID-19 pandemic accelerates its pre-existing financial perils.
We expect to see a 50% decline by this summer. That means half the volume of mail will not be there, including the revenue associated with it. That's catastrophic.
Virginia Democratic Congressman Jerry Connolly chairs the House Oversight Subcommittee that oversees the USPS.
If there were a disruption in the service or severe curtailment because of these financial circumstances, The areas that will be immediately impacted are rural parts of America, largely represented by Republicans. So I have a lot of Republican allies on postal issues in the House.
The bipartisan Postal Service Board of Governors, appointed by President Donald Trump, has asked for $25 billion in direct funding, $25 billion in borrowing authority, and $25 billion in grants to modernize the post office. But when House Democrats asked for $25 billion in funding during the stimulus talks, sources tell CNN the Trump administration rejected the idea. Instead, the Postal Service was offered the opportunity to apply for $10 billion in loans.
I'll tell you who's the demise of the Postal Service are these internet companies that give their stuff to the Postal Service. I don't run the Postal Service.
President Trump has repeatedly criticized the Postal Service, often blaming its economic problems on companies like Amazon.
They lose money every time they deliver a package for Amazon or these other internet companies, these other companies that deliver. They drop everything in the post office. They say, you deliver it. And if they'd raise the prices by actually a lot, then you'd find out that the post office could make money or break even. But they don't do that.
Connolly says package delivery accounts for roughly 5% of total mail volume and about 30% of revenue.
I think the president loves to have enemies, and one of his favorites is Jeff Bezos, the head of Amazon. And in his press conference last week, he absurdly asserted that the Postal Service would be fine if they just raised prices on companies like Amazon. Now, nobody who knows the economy of our postal delivery system believes that.
The country's founding fathers believed the Postal Service was so essential, they put it in the Constitution. It ensures many Americans receive necessary medicine and other critical items. The United States Postal Service is now at a critical moment of its existence amid an unprecedented pandemic. And Connolly says it's President Trump and his administration who must act.
His own understanding of the Constitution is clearly lacking very fundamentally. And unfortunately, the Postal Service is one of the casualties of that lack of understanding.
Thanks, Jessica. Look, this isn't easy on anyone. It isn't easy for the people who are sick in their houses and in the hospitals. It isn't easy on their families, and it certainly isn't easy for people who are out of work right now. We know Trump wants the country to be open. In a perfect world, we would all want the country to be open for people to have their jobs back and make money again. I want that too. I don't want anyone to suffer, but to me, we need to see more testing. There are still people who have clear virus symptoms, chills, fever, cough, sore throat, that, believe it or not, still can't get a test. That's a major problem. That shows that we are still rationing tests for who people consider the most important. We can't open the country under those circumstances. A premature opening would flood hospitals and healthcare workers with new patients with the virus. So until we get more widespread testing, at least for everyone who is sick, it is an absolute risk to open the country. At some point, we will get going again. We only get one shot to do it right, so let's make sure it's done right. Thanks for joining us this week. Be safe. We'll see you next week.